Have you ever wondered how vital your kidneys are to your overall health? These remarkable organs, each about the size of your fist, hold a crucial role in your body. They act as your body's natural filtration system, removing waste products and excess fluids from your bloodstream. Beyond this, they also help regulate your blood pressure, manage electrolyte balance, and even produce vital hormones that aid in red blood cell production and bone health. Now let's talk about a condition that affects these essential organs: chronic kidney disease, or CKD for short. In the United States alone, around 37 million people are living with this condition. That's more than 1 in 10 adults. CKD occurs when your kidneys are damaged over time, reducing their ability to perform their essential roles effectively. This isn't a sudden event, but a slow, gradual process that often goes unnoticed until it's advanced. The harm can be so gradual that many people aren't even aware they have CKD until it's quite advanced. But what does it mean to have CKD? It means that your kidneys are not filtering your blood as well as they should, allowing waste and fluids to build up in your body. Over time, this can lead to a host of health complications. The causes of CKD are many and varied, ranging from genetic mutations and diseases like diabetes and hypertension to autoimmune disorders and recurring kidney infections. But regardless of the cause, the result is the same: compromised kidney function that can impact your health in significant ways. So what happens when these crucial organs are damaged? That's what we're here to explore today. A myriad of factors can contribute to the onset of chronic kidney disease. Let's dive into the root causes of this condition. The kidneys are intricate organs, and their function can be disrupted by a broad range of factors. One such factor is genetic mutations. Yes, sometimes the very code that makes us who we are can turn against us, causing our kidneys to malfunction. Next, we have diseases like diabetes and hypertension. These two are particularly notorious culprits of chronic kidney disease. Diabetes, with its high blood sugar levels, can damage the kidneys over time. Hypertension, on the other hand, can cause harm by exerting too much pressure on the delicate blood vessels of the kidneys, impairing their function. But the list doesn't end there. There's also glomerulonephritis, an inflammation of the kidney's tiny filtering units. This condition can occur on its own or as part of another disease, such as lupus or HIV. It's a significant player in the development of chronic kidney disease. Autoimmune disorders too can wreak havoc on the kidneys. These occur when your body's immune system mistakenly attacks your own cells. In this case, it's the kidneys that bear the brunt of this friendly fire. Then we have polycystic kidney disease, a condition characterized by the growth of numerous cysts in the kidneys. These cysts can replace much of the kidney's mass, disrupting their function and leading to chronic kidney disease. Lastly, repeated kidney infections can also lead to this condition. These infections, if recurrent, can cause progressive damage, leading to chronic issues. So there we have it. From genetic mutations to various diseases and conditions, the causes of chronic kidney disease are as diverse as they are numerous. It's clear that CKD can be triggered by a variety of conditions, making it a complex disease to manage. Often, chronic kidney disease prowls silently, showing symptoms only in advanced stages. Such is the elusive nature of CKD. It's a quiet crisis that lurks beneath the surface, often revealing itself only when it has advanced significantly. One of the most common symptoms of CKD is swelling in the feet and ankles. This happens when your kidneys aren't able to remove extra fluid from your body, leading to edema, a condition marked by swelling due to fluid retention. But remember, edema can also be caused by a number of other health conditions, so it's important not to jump to conclusions. Anemia is another symptom that often accompanies CKD. Our kidneys play a vital role in the production of red blood cells. When they're not functioning properly, the production of these cells can drop, leading to anemia. You might feel fatigued, weak, or have trouble concentrating if you're anemic. It's a subtle sign, but one that shouldn't be ignored. Next, let's talk about taste, or rather changes in taste. CKD can cause a metallic taste in the mouth, or even a distaste for protein-rich foods like meat. You might also find that you're not as hungry as usual, leading to unintentional weight loss. Increased urination, particularly at night, can also be a sign of CKD. Your kidneys struggling to filter your blood efficiently could cause you to need to urinate more frequently. It's one of those symptoms that's easy to dismiss as nothing serious, but it might be your body signaling that something isn't quite right. These are just some of the silent symptoms of CKD. There are others like nausea, shortness of breath, or even trouble sleeping. But the real challenge with CKD is that these symptoms are often so general they can easily be attributed to less serious conditions or even just the stresses of daily life. The silent nature of CKD makes it all the more critical to stay vigilant about our health. Regular checkups are crucial, as early detection can make a significant difference in managing the condition. Remember, CKD doesn't have to be a silent enemy. By staying informed and proactive, we can ensure it doesn't catch us off guard. Given the stealthy nature of CKD, how do doctors diagnose this condition? Now that's a question that merits our attention. The diagnosis of chronic kidney disease, like many other conditions, involves a combination of clinical assessments and laboratory tests. Let's start with the basics. The primary method to detect CKD is through blood and urine tests. These tests give doctors a snapshot of how well the kidneys are functioning. They measure the levels of certain substances, such as creatinine and urea, which are normally filtered out by the kidneys. When kidney function is compromised, these substances build up in the blood, signaling a possible problem. Blood tests are also used to check for anemia, a common complication of CKD. Anemia occurs when there's a shortage of red blood cells, which can be due to the kidneys not producing enough of a hormone called erythropoietin. This hormone stimulates the bone marrow to make red blood cells. So, if the kidneys aren't working properly, you might have fewer red blood cells than you should. Urine tests, on the other hand, can help identify proteinuria, which is an excess of protein in the urine. Healthy kidneys typically don't allow a significant amount of protein to pass through their filters. But if these filters are damaged, protein can leak into the urine. The presence of protein in the urine is often a sign of kidney disease. Beyond these tests, doctors may also perform imaging tests such as ultrasounds or CT scans to get a visual of the kidneys and check for any abnormalities. In some cases, a kidney biopsy might be necessary, where a small piece of kidney tissue is removed and examined under a microscope. But remember, the stealthy nature of CKD means that many people remain undiagnosed until the disease has advanced. This underscores the importance of regular checkups, especially if you have high risk factors such as diabetes, hypertension, or a family history of kidney disease. Early diagnosis is key in managing CKD effectively. By identifying the condition in its early stages, doctors can implement treatment strategies to slow the progression of the disease, improve quality of life, and prevent complications. So, don't underestimate the power of early detection. It could be a game changer in your battle against chronic kidney disease. While CKD is a serious condition, it isn't a death sentence. Proper management can make all the difference. Chronic kidney disease, or CKD, is a long-term condition that requires active management to prevent further kidney damage and slow disease progression. The cornerstone of CKD management revolves around 5 key areas. Let's start with blood pressure. CKD can cause an increase in blood pressure, and high blood pressure can, in turn, worsen kidney damage. Therefore, maintaining a healthy blood pressure is critical. This can be achieved through lifestyle changes such as regular exercise, a balanced diet, and quitting smoking. Medication may also be necessary in some cases. Next, we tackle salt and protein intake. A diet high in salt can cause high blood pressure, while excessive protein can overwork the kidneys. Hence, a CKD-friendly diet often involves reducing salt and protein consumption. This doesn't mean you have to give up flavor or substance in your meals. Instead, it's about making mindful choices about the types and amounts of foods you consume. Thirdly, controlling cholesterol and diabetes plays a vital role in managing CKD. High cholesterol levels can lead to heart disease, a common complication of CKD. Diabetes, on the other hand, is a leading cause of CKD. Therefore, managing these conditions can help safeguard your kidneys. Lastly, it's important to avoid certain medications that can further damage the kidneys. These include non-steroidal anti-inflammatory drugs, or NSAIDs, and some antibiotics. Always consult your healthcare provider before starting any new medication. With these strategies, managing CKD becomes a proactive journey. You're not just reacting to symptoms, but actively taking steps to slow disease progression and maintain kidney function. It's worth noting that everyone's journey with CKD is different. What works for one person may not work for another. Therefore, it's essential to work closely with your healthcare team to develop a personalized management plan. Active management can slow the progression of CKD and maintain a good quality of life. Remember, living with CKD is not about restrictions, but about making healthy choices that support your kidneys and overall well-being. Now that we've explored CKD in depth, let's address some common questions people often have about this disease. One question that often comes up is, can CKD be cured? The answer is, unfortunately, no. Chronic kidney disease is a progressive condition, meaning it gets worse over time. However, with the right treatment and lifestyle changes, the progression of the disease can be slowed and symptoms can be managed effectively. Next, what lifestyle changes can help manage CKD? The most crucial lifestyle changes involve diet and exercise. Reducing salt and protein intake can help your kidneys function more efficiently. Regular exercise, along with maintaining a healthy weight, can also aid in managing blood pressure and cholesterol levels, both of which are essential for individuals with CKD. Quitting smoking is also highly recommended, as smoking can accelerate the progression of the disease. Another common question is, can I live a normal life with CKD? While CKD can indeed pose challenges, it's important to remember that with proper management and treatment, most people can continue to lead fulfilling lives. Regular checkups, medication, a healthy diet, and physical activity can all contribute to maintaining a high quality of life. Finally, how can I prevent CKD? While some risk factors, such as genetic predispositions, cannot be controlled, others can certainly be managed. Regular exercise and a healthy diet can prevent conditions like diabetes and high blood pressure, both of which can lead to CKD. Regular checkups are also crucial in catching any potential issues early on. If you have a family history of the disease, it's advisable to discuss this with your doctor, who may recommend more frequent screenings. As we've seen, CKD is a complex disease, but understanding it can make a world of difference. It's important to remember that while CKD is a serious condition, it's not a death sentence. With proper treatment, a balanced lifestyle, and regular checkups, individuals with CKD can lead fulfilling, healthy lives. And with that, we've shed some light on chronic kidney disease. Remember, knowledge is the first step towards better health.